share your experiences, because we are going to have another session later on, which I understand, which we're going to be using all your experiences or all the things that you share with us within the chat to talk to some of the policymakers and use that as evidence. So please do feel free to use it and share your stories with us within the chat function. Right. So I think I've done all the housekeeping, just double checking that I've done that. And the next follow-up meeting will be on the 21st. So like I said, the more information you give us, the more information we can take with us in those discussions. So with that, I would also suggest everybody to keep themselves on mute so that it would help with the flow of this particular meeting, but also it would stop the background noise and you'll be able to hear a lot more people clearly. And please do, if you do have any internet issues, do think about switching off your video, because that does also help with the connection. So with that, I'm going to move on to our first speaker and introduce our first speaker, which is Ripon Ray. I know you're here, who is from Brit Bangla COVID and has done phenomenal amount of work, I know, from a council perspective, and I've seen you do a lot of work within the communities as well. So over to you, Ripon. I'll give you about 10 minutes.
Thank you, Councillor Asma, and thank you for the intro as well. I also would like to thank Chris Tang for his work. Believe me, he's done a great deal of work on this issue as well. So thank you for giving me the chance to kind of talk about Brit Bangla COVID. So like Asma said, my name is Ripon and founder of Brit Bangla COVID. So really, what I'll try to do is briefly explain the background of Brit Bangla COVID and what it has done and types of campaign it has led, and hopefully also moving forward what it wants to see really. As you can see, Mark is briefly showing you the web page where you can see Brit Bangla COVID. The most recent article written, which also comes with podcast, is about I suppose a representative housing association and how that association had played a huge part in organizing campaign to make sure all the messages that we get around COVID are demystified, and done so for the benefit of minority communities, most importantly Bengali communities. As we all know, Bengali communities have suffered a great deal during the pandemic. So the question then is, what part did Brit Bangla COVID played? I'm ashamed to say though, Brit Bangla COVID started on a selfish level. It started on a selfish level because, if you remember, just by the end of March, the government said, from now on, you're going to have to go at home, work from home or else. So it was around this time I was forced to work from home. But as I was working from home, I was pretty much staring at, I suppose, three corners of my walls. And someone who's very social to just staring at those walls were a dramatic change. So in order to kind of like express the anxiety and mental health that I was affected by, I thought, let me reach out to others to see how they were going through. And they, in this case, I mean, other Bangladeshis. Anyone who knows about my work will know that prior to Brit Bangla COVID, I was a very vehement campaigner against austerity and focusing around austerity or anti-austerity. So since those campaign works were on hold in my spare time, what else can I do for the benefit of public good? And this is when it dawned on me that if I am Bangladeshi feeling like this, I wonder what other Bangladeshis in Britain and most importantly in East End of London were actually feeling. So this is when I started to organize my written work, my podcast, and the website that Mark kindly has shown us. So really, then I knew I wanted to interview others, but the question is on what terms would that going to be? Because I can't just randomly pick on anyone. So first thing I did for your own benefit, hopefully you might benefit from it, is wrote a script script that would involve understanding the lives of that individual I'm interviewing, early life growing up, work life, personal life, and what was life like prior to the lockdown, and how lockdown has changed their lives and what they really have learned from it. So that was pretty much the structure of the script that I followed, and then developed a leaflet that went around on social media, especially Facebook and other medias and WhatsApp groups. And of course, when I did that, I was flooded with stories of individuals, nurses, doctors, youth workers, prison officers, and pensioners. So this is how, I guess, Bangladesh formed, really, away from me to communities that focused upon. So yes, of course, I've interviewed probably over 20, 30, 40 people by now. But the interesting thing is, all the interviews, or most of the interviews, were carried out on Zoom during lockdown, because obviously we can't meet anyone. I can't see anyone, and we shouldn't be meeting anyone at the time. So I thought, how can I then use mainstream channels such as Zoom and such as this Microsoft Teams to understand the feelings and the anxiety of people, really. So that's how I interviewed. I interviewed people initially on podcast, and there are a couple of stories that really dawns on me. One was really a nurse who, during lockdown, she was forced to go to hospital at a postnatal ward, and she was also the first woman to handle a COVID baby. And she was worried, she's anxious, she's on her PPE, and she herself at the same time are thinking, how am I going to carry on with the job, knowing that having touched COVID children, I have to go back home and take COVID and maybe even give it to my family members. So that was her anxiety. And the other sad one was where after the 4th week of the lockdown, a banker from Canary Wharf in Tower Hamlets unfortunately was made redundant. So when he was made redundant, stuck at home, just like me, facing 4 corners, can't socialize, he felt he was in prison. But interestingly enough, it was his aunt who went to hospital for cancer, got treatment for cancer. She felt she caught COVID in hospital, and she fell ill, and then the redundant banker took our aunt to hospital, and they were told, I'm sorry, your aunt cannot be taken to hospital. If any one of you remembers, NHS had an initial policy that if you're 80 plus, please do not come to the hospital. And she was 80 plus, and she wasn't admitted to hospital because NHS had that policy. However, because he made a formal complaint against the NHS, the aunt was then able to go into the hospital, and then, interestingly enough, was at intensive care unit, was treated for over 8 weeks. Then she came out alive. Now, what could it have been had he not made a complaint, and had she no intensive care unit? She could have been another staff who have faced fatality, unfortunately. And of course, I have also interviewed who lost her sister as well as brother-in-law, and she was worried sick about what the way others are not complying with the rules around keeping yourself distance and wearing face masks. Weirdly enough, though, on the whole, what was interesting to me, and there is a pattern that I was seeing, especially with elder folks, and I'm sure many Bangladeshis will agree with me, many elderly folks were saying, what is the point of me complying whilst I'm going to die anyway? If Allah's going to take me to, if Allah's going to take my life, he will take my life anyway. So the real question is, when you have people saying, what is the point of complying whilst we know Allah will take us alive anyways? what is the response? What was interesting is that a lot of individuals who I've interviewed, they were challenging that perception to saying, yes, there is a responsibility upon us to make sure others are alive, regardless of simply about your well-being. It's not just simply about you, but also others. That was the interesting bit, really. Of course, since I was coming with so many stories, my question for me was, how can I then take this issue forward? So this is when I developed a survey whilst I was working with a solicitor and an artist. Three of us got together, formulated a survey, and then tried to look at the situation of those who have died, and also what kind of recommendation we can actually put forward. And interestingly enough, the survey looked at a housing situation, looked at education of those who have died, looked at also their literacy, and also how those who have filled in the survey got the information of the government, when the government's message initially, if you remember, was quite confusing. What was interesting is that the outcome of the report was that majority of the people were living in overcrowded condition, and that wasn't a surprise to me at all. But of course, I didn't dwell upon that, because those who were in overcrowded condition, they were actually leaseholders rather than tenant, based on the report that the outcome of the survey anyway. The other thing that was interesting for me is that the literacy rate of those who have died are GCSE or below, and we're talking about at least 75% of those who have died. The literacy rate compared to British standard was very, very low, and that was quite interesting. And of course, there were other things that came out, and of course, since I did say that I did capture stories, and you can see when Mark showed you the website, it has numerous stories. So I captured the stories with his surveys to create a report, to make it raw and immediate. And recommendations you can also see. And one of the recommendations was that we also need to focus on young people. And I think when I interviewed a young person on YouTube, she could not even make a sentence properly because she was stuck indoors for months on end. So psychologically, we all know adults have been impacted by it. But I felt from all the interviews, kids' voices were not heard. So young people, for me, was an issue, especially them getting therapy and them getting support. So yeah.
Can I give you a minute?
Absolutely, of course. And finally, I want to say we've organized a campaign around undocumented migrants, and I've realized that undocumented migrants have been ignored. So you can find on our website there were 15 different languages. So hopefully do have a look. And of course, if you have any questions, feel free to come back to me. Thank you, Asma, for taking your time.
Thank you very much for that, Ripon, and I'm sure we're going to get a lot of conversations later on about that. And thank you so much for sharing that. In the chat, there is there's a message in the chat where you can see the link to Brit Bangla COVID, and you can read about some of the research that Ripon has done, as well as the recommendation that he spoke about as well. So we are we've got a lot to say and we're running out of time. So I will ask Julie, I know you're here, but I can't see you. Julie?
Me now?
Yes, I can hear you.
Hi, thank you.
So I'll give you similarly 10 minutes and I'll prompt you when you've got about a minute or so. Is that okay?
That's great. Thank you very much. I wanted to thank Ripon for his really interesting presentation. He brought up very interesting issues and experiences that have related to the British Bangladeshi sort of experience of COVID. So that was fantastic. Thank you, Ripon. So learning about COVID in East London's Bangladeshi community is something that is very much a part of it's very pertinent to all of us really that are here in this meeting. So I'm really pleased to see so many of you. At the beginning of lockdown, I had the symptoms of COVID, although there was no test and there was no way to find out for sure. As soon as I realized that I had the symptoms, I put myself in isolation, and then the lockdown happened. And so, and I found that it was a very scary experience on a personal level. So that was the beginning of my experience of the coronavirus pandemic. After the isolation of 2 weeks, I went back to work. And in contrast to Ripon's experience, I was supporting people, vulnerable people, older people with dementia. And our day centre had closed. However, we began supporting people in their homes. So this was my work life. So I would put on PPE, gloves, masks, hand sanitizer, the lot, and we would go in and support people in their homes. On a personal level, I have a 74-year-old mother who has asthma and is also a vulnerable person. In my family as well, I have members. My brother, for example, is also a vulnerable person. So this pandemic was something that was very real, really, and something that I was living on a daily basis. We started talking about this experience with Chris Tang, who led on a proposal for funding with King's College London. And we wanted to document this experience really in a way that could be researched and researched in a way that sort of focused on the most vulnerable people and how they were being supported. So we were inspired by what Ripon Ray had done with his Brit Bangla COVID work on with his interviews on the website. And I could say quite literally that nobody else had done anything like this at all. So I think it was amazing initiative, and I have to commend him for the kind of work he's done off his own back, really. Very little had been done in mainstream media about the actual people who were suffering from COVID in the British Bangladeshi community. There was a news headline reporting on the impact of the Black and ethnic minority communities regarding COVID and the curry houses on BBC News in the early days, but nothing really about the individuals. And then, funnily enough, cartoons in Bangla featuring English subtitles started to pop up for children on social media. And then there was this explosion on social media, discussions in the Bangladeshi community about what was the impact of COVID. And people were sharing their experiences across the board. So Swadhinata Trust, which I am the chairperson of, we are here to promote Bengali culture and heritage to young people primarily, but we do lots of different work. We became a partner organisation with Chris Tang and the King's College London research to learn about COVID-19 in East London's Bangladeshi community. So we started to become the community researchers, myself and Ansar Ahmedullah. We divided it up into two parts. So I interviewed female participants and Ansar interviewed male participants, older people above the age of 60, the most vulnerable people we could find really. And we contacted people through our own networks, and we did this, as Ripon highlighted, remotely, because we could not meet people face to face. Now, a lot of these people didn't have access to sort of internet or smartphones. So we did a lot of these things on the phone. So we had to find technology to support this interviews, and we would call them up, explain what we were doing, and said, you know, we are going to record this interview on the phone. Now, Chris did a lot of work on this, sorting out the technology and supporting us with the technology. He gave us recorders, all sorts of things. So we were able to do this work on the telephone. And then, you know, we started doing this. As we started doing this, other studies started to focus on the South Asian experience of the pandemic. For example, Sussex University. Then there was, I think, Nazrul Islam with the Oxford University, looking at the first wave and looking at underlying morbidities, the Bangladeshis and Pakistanis and there was a high rate, a death rate in these particular groups that were being highlighted, and occupation was one of the biggest factors, as well as cultural and linguistic barriers. And like Ripon said, people not being able to seek medical help when they needed it most. We did this call out for participants across East London, but largely concentrated on our own networks because we wanted to be able to reach people, and it was the most effective way. The conditions that determined the interviews were over the phone, like I said, and gaining consent and recording did present a challenge because the face-to-face meetings were out of the question. Brit Bangla also organised monthly public meetings on health and social care online, and I remember that was really helpful to provide a forum for people who are going through this experience.
Give you a minute,
yes.
Julie.
So we finalised the guide and we collected the data. We also interviewed people's social contacts. So these are the people that supported the older people, and we looked at how they were supporting them. We provided vouchers for participation, and we mapped basically what was going on in Tower Hamlets and East London. I think what we found out that there is a higher risk of Bangladeshis who had twice as likely risk of dying from COVID than the general population. That was also reported in the media, and we were disproportionately affected by the mortality rate. After the second wave, we went into looking at test and trace system, and so there was a lot more emphasis on that, and we encouraged people to engage with what was going on by providing videos around corona awareness for different community languages that wouldn't have access to that kind of information in English. There was also a lot of fake news going around about the vaccine, which was very unhelpful. And then lots of talk shows started, Bengali talk shows started to show the impact of COVID on the British Bangladeshi community as well. We are going to be disseminating the findings that we've got through different areas, and we're going to be meeting with one of the Bangla channels this Sunday to promote this. But what we want really is for people to be able to engage with the research that we've actually done, and to actually look at the detail and the experience of the individuals that we have interviewed, and see how this experience has really been unique to a community, the British Bangladeshi community. Chris is also going to talk to you about this animated film that's been made with the help and support of the people that we've interviewed, and we're going to make sure that this information is disseminated to policymakers as well. So thank you very much for your time, for listening to me, and I hope to be able to answer any questions that you have at the end of this presentation. Thank you.
Thank you very much for that, Julie. And I didn't introduce you either, and you have been doing phenomenal work in Tower Hamlets. So Swadhinata Trust, I've known them for several years, and they've been delivering lots and lots of projects within Tower Hamlets. And as Julie spoke about, we've got a huge population of the Bangladeshi community in Tower Hamlets. And I know that they've been working very hard with the community in Tower Hamlets and researching and having conversations. And it's really good to hear that you got support from King's College to do a lot of this. So with that, I'm going to introduce Chris Tang as a leader of King's College London. And he is part of the Swadhinata Trust project. And I guess you're going to speak to us about how information was communicated and shared with the UK Bangladeshi community.
Absolutely, thank you. Can I just ask, can everybody see me? You can see me. Okay, I can see. I saw a sum up. Okay, just wondering something weird is going on with Teams or not. Thank you so much for the introduction, Asma, and thank you, Julie, for providing a really on the ground perspective of the project. I thought that was really, really useful. It's really interesting to see everything as it's unfolded over the past year through your eyes and your vision. And Ripon, thank you very much as well for your really insightful work. You've offered a really important platform for people in the Bangladeshi community to come together and share and advocate for ways of addressing some of the inequalities that have clearly been thrown into stark relief by the pandemic. I am just going to share my screen. I'm just going to try and fill in here by, first of all, being clumsy with Teams. Oh yes, I found it again. Hopefully, right. Right, it should be working now. Can you see my screen? That sounds good. Okay, great. Right, that's the end of the slide. That didn't work very well, did it? Sorry, I'll try that again. You'd think after a year now, we should be really fluent with this type of technology, but as you can see, can you see my screen again? Yep, I think, okay, so I'm going backwards to the presentation. Here we go. Hopefully that should be all set up for you now. So I'm just going to talk very quickly about the project from a sort of overview perspective. And I want to talk to you a little bit about, specifically about how this project has fed into and the development of the film that we're about to watch. I think that's really key here. So really, as Judy explained, the project arose very early on in the pandemic as it became, unfortunately, very, very clear that UK Bangladeshis have been disproportionately affected in terms of negative health outcomes. That's a horrible euphemism. It means more people were dying and were getting sick more severely. And at the same time, our previous research indicated that there would likely to be access issues because there was just one fit-all messaging at the start. Everything was in English, everything was written, most of it was written, let's say. And this combination of greater vulnerability and poor communication we felt was quite toxic. So we put in for a grant that looked at exploring how UK Bangladeshis were accessing, interpreting and sharing information about the pandemic. And as you can see from this timeline, we focused on community elders, and this is because they were most likely to have access issues and also more vulnerable. And we also, as Julie explained, I think we also interviewed members of their family, friends, their social networks, who they nominated as people who they relied on for accessing information in English they couldn't access directly. So we had a sort of view of two different generations, really, of the community. And as you can see from the timeline, these interviews took place quite early on, in just towards the end of the first lockdown. And by the time we analysed the data, we wanted to check if we had really heard these people's voices. I think it was, and of course, at the same time, the pandemic had changed and there'd been another lockdown in between. So we wanted to check if everything that we'd interpreted was still valid. So what we did is we held some focus groups with participants, but to get them to engage with our findings, we created a story that was based on their experience of the data, a narrative of a typical UK Bangladeshi's experience of the data according to them. And we presented that narrative to them in the focus groups, and they told us where we got the story right, which bits we had to correct, which bits we had to change, and then this adapted story from the focus group served as a basis for the film that we're going to watch, A Corona Story. And this film is really meant as a way of engaging the public with our findings. And before we go into the film, I do want to talk very, very quickly about our findings. We'll have an event on the 21st of September where we'll go over the project and its findings in a bit more detail, but we'll inform everybody who's signed up for this event about that one in due course. But just to give you a very quick overview, I suppose as from just listening to Julie and Ripon, it's not surprising to find that from our study, yes, we found that our older participants have struggled to access information. Not all of them, some of them, most of them had access issues because it was all in English, it was all written. But the access issue was much bigger than just it being in English or not. what we also took into account is the fact that our participants, all of them, apart from one, speak Sylheti, which is a language that I'm sure you're all aware is a language that's only spoken, it's not written down. And if you experience the world and express yourself about health in an oral language, you do it in ways that are really very different from the scientific written ways that are underlying the messages that were being used. There's no word for social distance in Sylheti. There is in Bangla, standard Bangla, but not in Sylheti. There's no word for clinically vulnerable or support bubble. These concepts can't just simply be imported and translated. They have to be completely reframed. And all of our participants, or most of our older participants, not all of them, showed a strong preference from oral ways of knowing and learning. So they got information about health from the doctor, but the doctors were closed. They got information by talking to their relatives, but their relatives couldn't come round as often. So it was really left to the family, friends and neighbours and carers to act, to share information about COVID with them. And this sort of information sharing practice is a bit of a double-edged sword. On the one hand, some of our older participants who had no, who said the only way they got information was by talking to their daughter, to their relative, to their carer. They knew about the symptoms. They knew about transmission vectors. They knew that the mitigations, wearing a mask, washing your hands, and so on. So clearly, this was a really important part of how the community learned about COVID. But at the same time, we have to think about this from the perspective of family, friends and neighbours. They aren't trained health professionals. They don't have communications training, and it's quite a difficult task to translate written information into an oral language. So it's unsurprising that we find some potentially problematic conceptualizations among our older participants, problematic in the sense they could put them at risk. So for instance, a lot of our participants conceptualize the household as a safe space. So for instance, we have this older lady who expressed this idea that you don't really get sick from close relations. She feels when she's close to her own, it doesn't affect me. Now, this is potentially a problematic conceptualization because COVID, obviously, you're most likely to get it from people who are close to you. So the onus really sort of shifts then to family members to keep that person safe. But the bigger issue is not really misconceptualization. I mean, that always happens anyway when you have communication. The bigger issue is the distance between written language and spoken understanding, and the fact that this information flow is all linear. As one of our participants said, my daughter speaks and I listen. That means, well, what happens if your daughter, family, friend or neighbor get the wrong end of the stick? What if they get misinformation? What if they're misinformed? There's no way for these people to verify whether what they're getting is actually the right information or not. And this has made the community quite vulnerable to misinformation, as we've seen, unfortunately. So what's the solution? What should we do? Well, from what we can see, it's not really about what should we do, but what have we done? There have been lots of really important initiatives that we've had the honour to be part of, and also that we've observed in the community, that have all done something that we've called mediation. Mediation is really this process of being able to access health information, understand it, decide if it's from a credible source or not, if it's reliable, understand if it's certain, if it's how certain the information is. Remember, we're continuously finding out new things about COVID, so it's not always 100% clear what we know or what we don't know. To take all of that complex information, these written scientific concepts, but also to have the linguistic and cultural knowledge to reframe those concepts in a way that is accessible and resonant for members of their community. It's a really tough task, but people have been doing this. This has been absolutely massive for the communities. And we've captured these various initiatives with the acronym EAR: Educate, Activate, Recruit. Educate through outreach. I'm sure most of you are aware of the initiatives like the COVID-19 Community Champions in Tower Hamlets. These are initiatives where members of the communities are trained up. They're given access to the latest health advice, and they're given communications training to support them in reframing that information. And the great thing about these sort of outreach initiatives is whether it's face-to-face, door-to-door, or phone calls, people who they're reaching have an opportunity to have a conversation. They have an opportunity to direct them to their informational needs. And that's really very important for people who are used to sharing and speaking about health and not reading stuff about it. Activate stands for activate youth. Young people in ethnic minority communities have the potential to be excellent mediators. They have great opportunities to communicate with. They're embedded in family units. They have access to information through social media, and they have linguistic and cultural insight in their communities. But they need to be activated. Otherwise, I mean, in our data, some of it seems like the young people are getting blamed for making the pandemic worse. They need to be activated, for instance, through social media campaigns. And this is a campaign from one of our partners. It's a PR agency that's involved in campaigning as part of the UN campaign to counter misinformation about the pandemic. And this is their Pause campaign, and it's really simple message: pause before you share. Pause before you share. So don't share information. It's really could be harmful. You could share the wrong thing. Make sure you think about what it is you're sharing before you share. And they've got a really great process. They recruit young people and train them up as health influencers, and then give them the agency and the access to information to act as mediators for their communities. So I think that's a really important initiative. And the final component to EAR is recruit local mediators. We've seen lots of people come forth from the community and act as mediators. Our data suggests that the most effective ones who are already there, ready to go as mediators, are local doctors. And this is because local doctors have access to the latest information on health. But they also, if they're local, they have linguistic and cultural knowledge of their communities, and they've got practice communicating with these people in their practices. They mediate as part of their jobs. So we've done, as part of our Corona Awareness Project, we've been trying to give these doctors a platform to create increased opportunities to communicate by recording videos with them and promoting those videos as shareable resources on social media. So that's in a nutshell what we mean by mediation. And of course, these various initiatives working together means that you've got lots of mediators out in the community, you've got lots of voices all saying the same thing, giving the right information, which means if you are used to all ways of communication, you can verify. There's not just one person you're relying on, there are several. And I think it's these types of things that have really made a difference, and we saw that with this turnaround in from South Asian groups were labelled as vaccine hesitant, and then suddenly they weren't. And this is because we had these public events, we had COVID champions, we had video messages, we had local mediators going out there, and in some communities we had young people being activated as well. So the film, just to move on. So I think I've talked for more than enough about the project, and I think everybody would like to see the film now. So I'll move on to that. Now the film, the point of the film is really to what we wanted to do is to promote awareness of mediation in countering the misinformation and already developing knowledge of COVID risks in the community. So the story we're telling of this family is really, as I said, the story of the data. It comes from all of these different things that the participants were telling us. Essentially, it's a health communication film. Okay, so we are trying to be a bit messagey. We're trying to engage with key conceptualizations like the home as a self space, while also reinforcing all these positive beliefs that were expressed by our participants that they got from their family members. But we're so lucky to have had Diwas Bisht come and use his artistry and vision to really animate these messages and the experiences of the participants that we're representing in the film that you're going to see. Now, I should make it very clear, this film that we're going to show you is not in its final state. It is a work in progress, and we're doing that deliberately because we want to get some feedback from you. We're going to send a feedback form at the end of this event, and please do give us some feedback on the film, because it's at a late stage of production. We can't do any big changes, but we're still working on the sound and the voice, and so there are things that we are going to tweak, and your input there could be really useful for that. The other thing I want to mention is that the film version that you're going to hear is a mixture of Sylheti and English. We've got subtitles, so everyone hopefully can follow. And when we didn't employ voice actors, we instead had people from the community to voice these different characters in the film. We thought that would be more powerful. We're also going to do a Bangla version of the film and to sort of increase its accessibility as well. So I think that's enough of me. I think we should go on and watch the film. It's only 5 minutes, so be patient. And then afterwards, we can then go to the Q&A.
Coronavirus jatua sil amra rasta katai amra dexiona hunsiona. This is my family story. You might like to think of it as your story. Here I am, working late as usual. There was a customer.
Channelta bodlaibaini amma. Boris won't shut up about this virus thing from China.
When we set out on our...
This was our community. And then life stopped. Afne lagi kila lagto pare. City lekha afne diabetes ase. El lagi ikta afne lagi beshi risky. Afne goro bitre takhte hoibo ar amra gesta ki horiya takhte hoibo. Jototuk সম্ভব তো আমরা আপনারে এই ভাইরাস হাসরাইতাম না করি আমি আপনার খানি আনিয়া দিমু অনো এটারে শিল্ডিং কয়
আমরা হরে হরে টাকমু কিলান আমরা যেহেতু একলগে থাকি আমি এখন আর দেখতাম পারতাম না
However much we sought distraction, coronavirus affected us all. Our families, our businesses, our community. I just wanted to help my family and keep them safe. What has my auntie sent me this time? 2 pieces of lemon up the nose will kill the virus. I can see why she would listen to some dodgy doctor from back home when the advice is all in English. Not everyone could understand it. And we were in such danger. Have you just come from the supermarket? You'd better change first. Think about Daddy.
Sure.
Assalamualaikum. Sorry khala, sorry khalu. আপনারে ভিতরে আইতে পারতাই না এখন তো লকডাউন
বাজে মা তাই তো স্টিকলার তাই তো ফার্মেসিস আও
আলহামদুলিল্লাহ তোমরা আইসো আমার দেখবার লাগে
I'm not being a stickler. It's not safe. দাদু তোমার ইনসুলিন দেওয়ার টাইম নাই এখন খালা আর খালু সরি আসি আসলে এলার সময় বেশি এখন বওয়া ঠিক না whatever works
রেস্টুরেন্টর খামালে হইছে মরা বাচ্চা দিয়া গু বানাইছে আর আমি আশা করছিলাম ও করোনার ভাইরাসের ইনজেকশন আছে মানে আমি খামো যাইতাম ফার্মু
Kamal shouldn't believe everything he reads on the internet.
এটা বলতাম মার তোমার জন্মের আগে আমি যেতাম দিয়ে দিতাম
সাইলে হইছে ইগু হইল সেফ ও তাই একজন ফার্মাসিস্ট
This was my family's story of how we tried to stay safe during the time of Corona. This cursed virus, this gozab as my grandmother calls it, wants to enter our bodies and our homes. It wants the help of the people we love the most. The vaccine is out, but coronavirus remains. So do all the false stories. What if I hadn't read up on the advice? What if I hadn't said anything? We need to keep ourselves informed about the virus. Tell our families, tell our friends. What happens next is up to us.
So Asma, are you there?
Yes, I am. That was, thank you so much for that. I was just trying to digest that film, and gosh, that it's such a powerful film. It's a very, very powerful film. It really did hit home for me. It's a lot of stories within that I've also heard as an elected politician, especially with the jab, especially with some of the myth busting. It's really, really phenomenal. I was thrown away by that. So thank you very much for sharing that. And as mentioned by Chris, please do write in the chat, share your stories within that chat, as well as do make recommendations or give feedback to the film as well. Right, I'll move on to the Q&A. I'm sure we've got lots of questions. Please do use the chat function to drop a question, or use your hands up function if you've got it on your screen, or do switch on your camera and use your physically put your hand up. If I can see you, I will call on you, or just shout out, I guess, because I think it's got a very small group of people here. We can be quite candid, I guess, if we would like to as well. So do we have any questions from anybody who would like to ask our panelists? I should introduce you who the panelists are. So the panelists are, and I'll ask you to turn your cameras on. So it's Diwas, Kazi, and Julie, Ansarullah, Ripon, and Chris. So can you guys please? Brilliant, you guys done that quite instantly. Fantastic. So these are our panelists. So please do raise your hand, and I shall try and see if IT allows me to know who has raised their hand. Brilliant. So I've got Rita, and then I'll take Bashir.
Congratulations to everybody involved in this. I think you're all doing some incredibly amazing work, and I'm totally blown away by that film. And it's on that point, it strikes me that the Bangladeshi community has been left out of a lot of the public discussions around health inequality, apart from in Tower Hamlets. What can we do collectively, more broadly, to either show solidarity or support our public bodies to better understand that health inequality really hits hard on the Bangladeshi community?
Thank you very much for that question. So shall I try and I might take Bashir, and then I'll ask one of the panelists to come back to answer that. So can I take Bashir? You will need to unmute yourself. We cannot hear you.
Thank you. Sorry about that. That is actually what I was going to ask as well. We at Bangladesh Organization have done a lot of work on COVID-19 through the pandemic. And you know, this video, the Sylheti video we just shown, we have actually done similar videos. We've done 3 videos, in fact, in Sylheti, and we found them very engaging. And I did explain all that to Ripan during my interview. And I felt that we, you know, all the speakers this evening, they are doing a fantastic job. And it's time, I think, we sort of, the people who've been working with our community in our own ways, we need to get together and see how we can try and sort of get to the policymakers and see how we can contribute to making the changes. You know, this disproportionate impact that the Bangladeshi community had during the pandemic. We don't want to see this is happening again. when another pandemic comes across. So we need to be ready to take on another pandemic. And how can we do that? And I think through our experiences, we have learned a lot about our community and how vulnerable our community is in lots of different ways. And obviously, you know, I can talk about my experience, you know, and I'm sure you have not the patience or the time. And I would like to sort of sit around with you people and politicians, policymakers, and share our experiences and see, you know, what can we do as a getting together, everybody getting our heads together, and what can we do for not only the Bangladeshi community, for everyone, for the wider community, before it hits us again. And that, you know, that's what I wanted to say. Thank you.
Thank you very much for that. So who wants to start off answering Rita's question around health inequality? I'm conscious that I can speak forever, and I probably would love to always answer everything as well. So Julie, thank you.
Yes, hello. I've put in the chat that there are other areas in the UK that GPs and other health professionals are working with the British Bangladeshi communities, and they're using social media really to reach out to people, because that's the most effective way that some people are be able to communicate messages. The mainstream sort of media outlets haven't been really great. The BBC did put out some South Asian messages with the newscasters in the earlier phase of the pandemic, but there's nothing been done as a follow-up. So I think it's something that, you know, people in the communities need to be able to do, you know, stakeholders, and we need to be able to facilitate that as much as we can.
Thank you very much. Ripon?
Yeah, having explored so much, it's difficult, Asma, for me to know where to begin, because if there are minute issues, yes, we can address it. And I'm pleased to see that Tahammuz Council have taken an issue on youth and mental health, which is fantastic. Those things could be addressed because youth brain is evolving, so therefore it's easy to tackle heads on straight away. But there are other issues. When I did the survey where I interviewed over 80 Bangladeshis who know people have died, how do you deal with issues like most of them are leaseholders who took the survey, and those who have died, they know, are leaseholders. So obviously that's a tough one. That's an institutional one. That's a bigger question. But in terms of avoiding complications, in terms of health campaign, health awareness, some things that we could do in terms of the way we communicate, either verbal or written, or using billboards to make sure, or even visual means. I think what we are lacking is that in public domain, we're not seeing enough visual things to show that is capturing. And I think you're right. And also we all know that written isn't good enough in Bangla, especially the elderly folks whose literacy rate is very limited. And of course, Sylheti is different from actual Bangla. But I mean, that can go on all day, but at least I could say something. And in terms of solidarity though, and of course it is about us making sure we remind others what needs to be done and how needs to be done when possible, rather than just going into our own personal cubicles and not think about others.
Thank you very much. And Chris, I'll ask you to respond as well. I'm conscious that we've only got a few more minutes left.
Yeah, thanks for that. Sorry, I'm in the middle of a coughing fit. Yeah, I totally agree with all those points. I would like to say, yeah, just very quickly, I think I echo that point. I think there's an opportunity here to learn, to create a legacy from this pandemic about some of the things that could be addressed. I can't really speak to a lot of the things, a lot of the reasons for why UK Bangladeshis have been disproportionately affected. There are lots of reasons for that. I know a bit about one of them, which is communication, and we have got some clear guidelines for that. We do have a model for how mediation could be worked and harnessed as part of a local and national initiatives to reach out to local to minority ethnic groups who have an oral cultural tradition, like Sylheti, for instance, or Pahari. We've worked with these other communities as well, and Pashto as well. We're also trying to develop guidance that can be given to people who are working in those communities, people who are working with residents who don't have much of a clue about how oral understandings of COVID and health are very, very different. So we're going to try and produce some guidance on that and disseminate it widely. We have an event coming up with policymakers and politicians, and we will take your comments from this meeting to that one. Also, there'll be opportunity to comment on the evaluation form. So if you add your commentary to that, we will also take those comments and experiences to that meeting. But yeah, I absolutely agree. I think there's an important opportunity here to develop legacy. I've just seen I'm really pleased to see Becky say something about useful classes. I'm a language teacher by trade originally, so I couldn't agree more. Language classrooms are really good opportunities. There's actually that's another project waiting to happen. So Becky, I should have a chat with you at some point. Okay, that's all I wanted to say. Are we completely out of time, or can we have 5 minutes beyond the meeting session mark, or are we going to get cut out?
Yeah, we're about to cut out in like 20 seconds.
Oh, right. Okay.
Right. So within 20 seconds, can I thank everybody for participating in this event, but also please do feed us your feedback. As Chris has said, it's really, really helpful. There is another meeting set up where they are going to be taking all of this information to policymakers. And it would be really, really helpful to hear a lot of this. This is how Tower Hamlets did it. So, you know, we spoke about Tower Hamlets throughout the presentation. There's been some comments about it, but it was based on local communities getting together, similarly like Chris and Julie, Ripon, getting together, telling us what the issues are, what the hurdles are, for us to then think of COVID champions, you know, WhatsApp groups and so forth. So I guess the driving and the steer comes from yourselves for us to then go and actually think about delivering it and look at ways of how we can deliver it. And like I said, can speak forever about Tower Hamlets. Lots of work happening in Tower Hamlets. We're quite fortunate to have lots of elected representatives from the Black and ethnic minority communities. So therefore, we had a little bit more of an advantage. But thank you so much. Please do fill out the evaluation form and do give feedback to the film. And I'm leaving it as that's, given that I haven't been cut off. Wow.
Yeah, I think we were just worried that it would shut out, but Teams sometimes is kind to us, so it's given us a bit of time to say goodbye to everyone.